Hello, my name is Kelli Williamson, and this is my friend Morgan Stoggsville, and today we're going to be doing a clinical bedside evaluation. So the first thing that I'm going to do is I'm going to introduce myself. I'm Kelli Williamson. I'm going to be your SLP today, and we are just going to do a simple clinical bedside eval to see how you're swallowing and chewing.
Okay.
So can you tell me your name and your birthday?
Morgan Stockstill and 9/28/95.
All right, and in most settings we would check the bracelet just to make sure we have the correct patient. Are you having any difficulty or pain while you're chewing or swallowing?
Mm-mm.
All right, so do you have any allergies before we get started?
Sulfa drugs.
Okay, so no food allergies.
Mm-mm.
All right, so we have our gloves on and all of our supplies laid out beside us. So the first thing we're going to do is just look at structure. So for this, I'm looking at the symmetry of her face. So there's symmetry on both sides. I'm not seeing any major scarring or lumps in her throat, anything like that. And so we're going to look inside of the mouth. So I just want you to open up for me and say, ah, ah. Stick your tongue out for me. All right, can you lift your tongue up and let me see? All right, so that looks good. Now that we've looked at just the structure, we're going to look at function. So we're going to be looking at how all these structures are moving. And the first thing we're going to do is just open and close your mouth. All right, good. So now we're going to do it with a little bit of resistance. I'm going to put my finger underneath your chin, and I want you to open. All right, and now open up and try to close. Okay, good. So after that, we're going to move from side to side and then protrude your bottom jaw like this. Good job. So the next thing will be lip function. So I want you to pucker your lips and then smile and alternate those two. Good. All right, so this time you're going to close your lips together and fill your cheeks with air. And you're going to let me press on it, but don't let me push the air out. So, all right, good. So that showed that she has the ability to create a lip seal. Now she's going to hold her lips together, and I'm going to put the tongue depressor right in between her lips, and you're going to not let me pull, okay? So open for a second, right there, close, and don't let me pull. All right, now we're going to do the other side. There. Awesome. Okay. So we're finished with the lips, and now we're going to do the tongue. So I just want you to protrude your tongue straight out. There we go. And now move it from side to side. Good job. Now I want you to pull it back in, which you did. So I want you to place your tongue behind your two front teeth, like this. And you're going to slowly pull it back like you're scraping peanut butter or something off the roof of your mouth. All right. Awesome. Good job. So the next thing that we're going to do, if I can set this down, is I want you to raise your tongue tip up in the air like you're trying to lick your top lip, and then down like you're going to lick your bottom lip. Good job. So now after that, I'm going to place my hands on your jaws, and I want you to use your tongue and press against them. So like that. Ready? All right, so we got that on both sides. So the next thing is going to be, you're going to pull your tongue backwards in the position to make the G sound. And you can make that sound.
G.
There we go. All right, so the next thing we're going to do is diadochokinesis. I'm going to have you say a few sounds for me for 10 seconds each.
Okay.
So the first one we're going to do is pa 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 pa. All right, good. So the next one's going to be ta 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 ta. Stop. And now ka 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 ka. Okay. So now we're going to combine all of those and say padaka 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 for 10 seconds.
Padaka, 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 padaka.
All right, stop. All right, and that showed us your ability to move from the different tongue positions for making sounds. So next we're going to look at your soft palate. which is going to be the roof of your mouth. So I'm going to use my tongue depressor and the light, and I just want you to open up and go ah, 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 ah. Good. All right. So now we're going to check your gag reflex, and I'm just going to place the tongue depressor on the end of your tongue and slowly walk it back until we trigger the reflex, okay? So, okay, good job. So now we're going to check your oral sensitivity. I'm going to place my tongue depressor on different areas of your mouth, and I want you to raise your hand to show me which side.
Okay.
So we'll do a test run first. So open up. Good. Okay, here we go. So, right. Good. Okay, good job. All right. So our next step is going to be just testing your voice quality. So I just want you to say ah, ah. Good. So now I want you to take a deep breath in, and I want you to say ah, but I want you to keep going as long as you can. So ah, ah. Okay. And so for this case, we did that for 20 seconds, which is normal for an adult. And now we're going to kind of look at your pitch. So I want you to say ah, but you're going to change pitch this time. You're going to go ah, ah. Awesome. All right, so I want you to cough for me. Just give me 2 big coughs. All right, and now I want you to clear your throat. Good. So now I'm going to have you just take a normal swallow while I palpate the throat. Okay. All right. Okay. So now that we finished with the oral Mech portion, we can move on to the food trial portion since everything was within normal limits.